For our webinar in the Pathways to Prevention series. Today's session is entitled Heed Neglect to Disrupt Child Maltreatment. We'll be talking about implications for prevention, and we'll be hearing from Dr. Lindsey Bullinger about the research she conducted in collaboration with Carrie Raytheon and other co-authors, Megan Feely and Will Schneider. This series is a partnership between the Injury and Violence Prevention Center and the Kemp Center for the Prevention and Treatment of Child Abuse and Neglect. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health and Director of Outreach with the Injury Center. Both of our sponsoring organizations are based at the University of Colorado Anschutz Medical Campus in Aurora, Colorado. And as we gather, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. The Pathways to Prevention webinar series is designed to connect prevention workers with the latest science on protecting children and ensuring well-being of families. We offer these free monthly webinars for those working in public health organizations, social services, child welfare, and the nonprofit sector. And during these sessions, you'll hear from researchers working on a variety of different topics in the primary prevention of child abuse and neglect, as well as adverse childhood experiences. We hold them on the 3rd Wednesday of the month at this time. And we also will be recording today's session, and you can access that recording. We'll send an email out with those links after the session. And if you miss another session that you'd like to watch, you can find those recordings on our website. I'd like you to note the upcoming session on February 16th. We will feature Dr. Alan Detlaf, who's the Dean of the Graduate College of Social Work at the University of Houston. He'll be discussing racism, racist inequities, and the child welfare system. And I'll put a link in a moment in the chat to register for that if you'd like to get it on your calendar. I also want to mention that at the end of the webinar today, you'll be directed to a brief feedback survey, and I hope you'll take a few moments and share your feedback with us. Very helpful to us in planning future sessions in the series. So before we jump into the presentation today, I'd like to see who's joining us. Please take a moment, open up the chat box in Zoom and share your name, your organization, and where you're joining us from. Hi, Alice, Lindsay. Great, I'm seeing those come in. I see Wisconsin, Dallas. Okay, wonderful. Folks from Human Services, Child Welfare, researchers, looks like. Wonderful. Keep it coming. That's great to hear who's here today. Always nice to have a mix of different roles and sectors represented, and makes for a really rich discussion. So remember that throughout the presentation, you can put questions in the Q&A box or into the chat for our presenter, and we'll make time at the end for questions and discussion. So now I'd like to introduce Dr. Bullinger. She is an assistant professor in the School of Public Policy at Georgia Tech. Her research examines how public policies affect children and families' health and well-being, especially low-income families. And her work has been published in many journals and funded by the U.S. Department of Health and Human Services, Doris Duke Charitable Foundation, Horowitz Foundation for Social Policy, Spencer Foundation, and Pew Charitable Trust. She has a PhD from the School of Public and Environmental Affairs at Indiana University, Bloomington, and she holds an MPA from the Maxwell School of Citizenship and Public Affairs at Syracuse University, and a bachelor's degree from Miami University in Ohio. So thanks so much for being here today, and I'll turn it over to you.
Great, thank you all for joining today. I'm very excited and pleased to be sharing some research which has quite a lengthy history, but is also somewhat new. And so that juxtaposition we'll dive into a little bit in a little bit. So I want to first mention that a lot of this work that I will be discussing today is joint with Megan Feely, Carrie Raytheon, and Will Schneider. And the Heed, Neglect, Disrupt Child Maltreatment, this paper that I will be discussing first, and the ideas that are in that paper were published in the International Journal on Child Maltreatment, Research Policy and Practice in 2020. All right, so just a quick introduction to child maltreatment for those of you who may be unfamiliar. A recent study showed that about 37% of all children in the United States are the subject of an investigation by Child Protective Services. So that's about 1 in every 2.5 kids, which is the equivalent to the current coverage rate of Medicaid for children in the United States. This is a very large fraction of children. We know that child maltreatment has all sorts of short and long-term consequences for both children and society. So, for example, in the short term, children who are victims of maltreatment suffer from attachment problems, cognitive development delays, and impaired social functioning. In the long term, children who are victims of maltreatment are more likely to experience depression and behavioral problems. They have worse health. They're more likely to be unemployed and experience poverty, greater use of social services, and more likely to commit crimes. And I want to point out that these are not just these facts that I've described here. These are not based on correlational studies. These are based on causal studies. And so we're not necessarily just comparing children who are victims of maltreatment to children who are not victims of maltreatment. Instead, these studies are taking a variety of different empirical approaches to really try to isolate the true effects of the maltreatment itself, as opposed to several of the potential confounding factors that may be also at play in the lives of these children. From a societal perspective, it's a very expensive issue. Every year, $428 billion is spent on the consequences of maltreatment. And that's not including the investigative costs. So for example, CPS investigations, when we account for the investigative costs, this amount reaches $2 trillion every year. So of those child maltreatment reports, so far I've been talking about child maltreatment, which can include physical abuse, sexual abuse, emotional abuse, and neglect. By far, the most common form of child maltreatment is neglect. It's about 3/4 of all child maltreatment reports are neglect reports. And so just to clarify some terms here, neglect, when I refer to neglect, this could be material or physical neglect, which consists of the omission or lack of basic necessities in a child's life. So for example, food, medical care, clothing, or shelter. Alternatively, neglect could also be supervisory neglect, and this would be, leaving a child unintended or in an unsafe situation, for example. So both of these, supervisory neglect and material neglect, consist of this whole neglect component of child maltreatment. So this figure is not from, this is not our original work. This is a paper by David Finkelhor and his colleagues. And this figure here is showing you decades of rates of child maltreatment. So this top green line here, this is showing you the neglect rate. And these are substantiated cases of maltreatment. So that green line there is showing you neglect from 1990 to 2016. This red line here is showing you physical abuse. And the blue line here is showing you sexual abuse. So what is most clearly evident from this figure is that the red line and the blue line, so physical abuse and sexual abuse rates, these are declining over the late 90s and early 2000s, and continues to decline, has continued to decline throughout this time period. However, neglect rates, you'll notice here, is basically the same as what it was in 1990. And so neglect rates are really not changing at all, despite the enormous progress that we've made as a society in reducing sexual and physical abuse. This figure here is showing you child fatality rates from 1970 to 2016 by cause of death. This figure is in that International Journal of Child Maltreatment paper, the Heed, Neglect, Disrupt Child Maltreatment paper. And so this is our original work. And what this is showing you here is that we've made some tremendous progress in reducing childhood fatality rates in a variety of causes of death. So just for example, we've reduced influenza and pneumonia deaths among children between ages 0 and 14 considerably over this time period. We've also seen reductions in congenital malformations among infants. We've seen reductions in deaths due to malignant neoplasms, for example. We've also seen reductions in deaths due to motor vehicle accidents. This thick black line right here, this is showing you deaths from maltreatment, of which 80% of these fatalities have in some way neglect involved in those deaths. And so what you'll notice here is that all of this progress that we've made in reducing childhood fatality rates over the course of decades is in other types of deaths. And so the maltreatment fatalities, which by the way, we didn't even begin recording until the late 90s, you'll see that those are actually increasing when all of these other fatalities are decreasing. So this is quite alarming. And one of the reasons why we think this is such an important area of research. So in our Heed, Neglect, Disrupt Child Maltreatment paper, we're really trying to understand how all of these deaths due to other causes have declined substantially over this time period, while at the same time maltreatment deaths are increasing. And as we've seen, even the non-fatal causes of death, the non-fatal maltreatment cases that are neglect, those are remaining stagnant as well. So if you take the public health lens for reducing any sort of problem when it comes to health outcomes, there are these three basic steps. So first, clearly identifying the fatality outcome in this particular instance, understanding the mechanisms that lead to this particular this cause of death, and then implementing these macro level policies and campaigns to then change the behaviors, which will then subsequently reduce the fatalities. So that's sort of the big picture here in terms of the public health approach to reducing any sort of negative public health outcome. So with this model in mind, we can just take a look, for example, at motor vehicle accidents, fatalities due to motor vehicle accidents among children in particular. So the first thing that was identified early on was that riding in vehicles was the problem for children. And so it wasn't that children were dying as a result of riding bicycles, for example. They were inside the vehicles. The goal then became to reduce motor vehicle accidents by making all driving safer for everyone. For example, when we do this universal prevention, this involves everyone driving the speed limit, not just those who are identified as being unsafe drivers. From there, research determined the primary factors in motor vehicle fatalities. And then advocates identified interventions that would essentially get at those primary factors to reduce the outcome. Here, the fatality from riding in a vehicle. Just as some examples, some interventions included requiring car seats or booster seats, passing graduate driver's licensing policies, enacting speed limits, enforcing laws affecting impaired driving, such as blood alcohol content laws, minimum legal drinking age laws, zero tolerance laws, and other higher alcohol taxes. We also incorporated awareness campaigns. So for example, the Friends Don't Let Friends Drive Drunk campaign. There was a very big push for safe car seats and safe booster seats. From there, manufacturers also got involved in this process, and themselves, manufacturers improved the safety of vehicles. So this was a huge process, right, for reducing the motor vehicle accident fatality rate among children in particular, and it required different stakeholders from a variety of dimensions. So why is neglect still so high when we sort of know what works in terms of this public health lens? So potentially reducing neglect is challenging because it's the result of a complex set of interactions that our current systems do not prevent in an effective manner. So in part, this figure here is showing you that, first of all, that neglect here, as I noted earlier, is substantially higher compared to these other types of abuse, physical abuse, emotional abuse, and sexual abuse. And further, this figure here is showing you that children in low-income families are much more likely to be reported for neglect than children in high-income families. I mean, substantially, it's enormous. This line here is so different. So not only do they make up a substantial portion of neglect cases overall, but this disparity here is much larger than the disparity in any of the other types of abuse. So one reason, if we think back to why reducing neglect may be challenging, is because so far our systems are really, it's very challenging to separate true neglect cases from poverty-related issues. And so there's this huge confluence, and a variety of scholars and disciplines have mentioned this and focused on this as a challenge for child protection and child maltreatment prevention. And so the other point here that I want to make about neglect being so challenging to affect is that it's not necessarily the result of intentional behaviors that can be easily changed. So for example, family interventions, which currently the approach is, a report is made to CPS, to Child Protective Services agencies. From there, CPS will identify some sort of therapy. Maybe it's a behavioral therapy, or maybe it's some other form of psychosocial intervention. But the reality is that neglect is the result of the omission of some sort of behavior, as opposed to an intentional commission of a behavior. And so therapy and other sorts of psychosocial interventions are unlikely to work because there's nothing that a family can do to change the situation, the economic situation that they're in many cases, particularly because many macro level factors are combining to suppress this family's ability to enhance their child's well-being. So one question is, okay, what causes neglect? If we want to prevent neglect, we need to identify the causes of neglect. Now, before I head into some of the other features, I just want to check in and make sure. I can't see the chat, so I think Carrie and Sarah are both navigating the chat. So I want to pause here on this big picture question about thinking about what sort of things do we think cause neglect, and how we might then intervene in those root causes. But real quick check in terms of questions or comments. Anything so far?
We do have a question that came in about whether you can quantify. Do we have any idea of how many of the neglect cases were due to poverty and not over neglect? And maybe you're getting to that, or there may not be data on that, but that's a question from the audience.
Yeah, so the one way that some researchers have tried to answer this question is to look at unsubstantiated cases of neglect, for example. And so the idea here is that a neglect report comes in. CPS, if it's a screened-in report, then CPS will investigate, and if the investigation does not produce enough evidence for due cause, then the report goes unsubstantiated, and there's not enough evidence to confirm that neglect in fact occurred. So some people will use unsubstantiated cases as the measure. There are issues with this, however. Different systems, different CPS systems, for example, have different approaches for assigning investigations, and so it's not perfectly clear that that's the right measure. There is some scholarly work from in particular from qualitative work that suggests these what some will refer to as light touch cases, where mandated reporters, for example, teachers or healthcare providers or law enforcement officers or social workers, will report a child because they maybe showed up to school sort of unkempt or maybe a little bit dirty. And so they report the child to CPS with the idea that they're going to get help from CPS. But that isn't necessarily what CPS agencies are equipped to do. They don't necessarily have the tools to help the families in the way that the mandated reporters intended. And so So it's not, I wish I had the number, right? Like X% of neglect cases are just due to poverty related causes. Unfortunately, I don't think we have a good estimate. People will say a substantial portion of them are, but I don't think we have a precise number. Carrie, do you have anything you want to add there?
I'm going to put a paper in the chat by Katie McGuire-Jack and Sarah Font. I think the question that Lindsey will be getting at that I think is super interesting is like, while we don't have the specific number, we can think about how policies can improve that number. And I think that's an interesting part of what Lindsey's about to talk about. So I'm excited.
Any other?
We had a clarifying question from Amanda. Does neglecting a child's social emotional needs count as neglect?
It does, yes. Now, whether it gets reported, whether it gets investigated, and whether it gets substantiated is a different question, but it does count as neglect, yes.
Okay. And Sally,
so I should also note that there is no federal definition of neglect or abuse for that matter. And so these are also state-specific definitions.
Okay. And Sally Blackwood commented bringing oppression and inequity in as a framework for thinking about this. An important point. And then Beth added neglect and personal bias. Heard a great example of holy genes on a wealthy person are seen very differently than a person who works and their genes have holes in them because they were worked in. And so thinking about bias, racism, some of those factors as well.
Yeah, and it sounds like you're going to get in this in your next webinar with Alan Detlef, who is the expert in one of the experts in this particular area.
Great, yeah, and just a comment from Ruby, not to mention the negative impact on a family that has a CPS report made. We need to equip our schools and community partners to help these families rather than simply make a CPS report. Sometimes that report is the way that's seen to get services for a family, and that's a very complex issue. Okay, and then just looking, great discussion happening in the chat. Alma raises that hotline referrals that are evaluated family needs that don't rise to abuse or neglect are referred to community agencies. And talks about concrete supports and economic development and other light touch services that are offered for free, as well as linkage to more traditional services. And then perhaps we're going to talk more about policy issues, but Peter raises the problem of neglect of families by policy. And folks are talking about capitalism, poverty, oppression.
Yeah, it sounds like a great discussion.
Yeah.
So if there are any pointed questions, I'm happy to take those, but keep that discussion flowing. So in terms of thinking about, this public health lens for preventing neglect, in order to prevent it, you sort of need to understand what causes neglect. And so in particular, as the discussion has noted, if we think about poverty as being a causal factor in the perpetration of neglect, we can start to, think about how we reduce neglect and its short and long-term consequences before those exact mechanisms are understood. So what we're actually arguing in this paper, and then also in the paper that you see here, this is an extension of that work that's been published in the Annals of the American Academy of Political and Social Science. What we're arguing here is that, maybe we don't necessarily need to understand the exact mechanisms before we can start enacting change to prevent neglect. And so this model here, what we propose in the Annals paper, and when we fondly refer to this paper as the time and money paper, basically to reduce neglect and to prevent neglect, what parents and caregivers need is time and they need money. And so in the majority of cases, okay? And so we have a bunch of ways already in our existing social safety net to address time and money. And so what we argue is that we need to build sort of this or think about that all of these individual level policies and programs in sort of a synergistic manner, And so just as an example, we've got food support over here. This is things like the SNAP program, the WIC program, the National School Lunch Program, housing choice, and low-income housing tax credit as part of sort of the housing dimension. If we think about family supports, we've got child support enforcement agencies, we've got family leave policies. If we think about medical care and medical assistance, we have Medicaid and Children's Health Insurance Program and a variety of other health programs. When we think about education, there's Head Start, there's the public school system for older children. And then a substantial portion of these programs are sort of in the money space, right? And when we think about programs like TANF or the Earned Income Tax Credit or the Child Tax Credit, which is part of this, the expansion in the Child Tax Credit in the past year, unemployment insurance, other sorts of safety net programs that are really focused on the money aspect. And so what we argue in this paper is that, look, all of these different programs, they may not be designed to reduce neglect or even think about neglect or children's well-being in this way, but they can have an impact. And there's some documentation that some of these policies do, in fact, have an effect on things like child neglect rates. And so one very tangible piece in this paper that we sort of argue is that, how whenever a policy or a proposal or a piece of legislation is coming forth, we always ask, what's the effect on unemployment rate? Well, what we argue is, we really need to put children and child well-being at the center of all of these policies as well. And let's elevate the importance of child neglect, where we think about it in the same way we think about the unemployment rate. What is the effect of this proposal or this piece of legislation on child neglect rate? Essentially, what we argue is that child neglect should be the responsibility of all of these different social policies and economic policies. It is not just the responsibility of Child Protective Services, but these programs can all address neglect in a different way, in an important way. And so we need to hold these policies responsible for doing that. This is not new, at least the idea itself, maybe the framing is new, but there are several examples that support this type of model for reducing and preventing neglect. So I'm going to walk you through some empirical examples. Some of them are by Carrie, myself, and others, and some are I have absolutely no stake in the game. It's just really great scholarly work. All right, so the first thing I want to note here is that statistically speaking, the highest prevalence of neglect is among single female-headed households, in particular when we think about neglect. And we also know that this particular population is the target, and sometimes the target of various policies, or in other ways can be a beneficiary of various policies. So just as an example, if we think about the minimum wage, the typical minimum wage earner is most likely a woman who's responsible for running a household and raising children. We also know that the Earned Income Tax Credit in particular is very focused on unmarried women, and child support policy changes are also targeting unmarried women. And so if we think about some of these policies, the minimum wage, the Earned Income Tax Credit, and child support, many of these policies are overlapping quite a bit with the population that's most at risk of perpetrating child maltreatment, in particular neglect. So with that in mind, we're going to go back to 2013. Maria Kanchian, Miyun Yang, and Christy Slack had a really terrific paper that uses the 1996 welfare reform as a way to examine the effect of additional child support income on child maltreatment risk. And so what these authors do is they compare, they have a randomized assignment where some individuals who are involved in the child welfare system received the full amount of child support that a non-custodial parent sent, and a control group basically didn't get the full amount. They were subject to a pass-through policy where the government kept a portion of that child support income. And what they found, this is sort of their main table. If you think about a one single table, that would be the takeaway from that paper. What we see here is that the experimental group, these are odds ratios, and what that means is when the number is less than 1, we see a reduction as a result of some policy. And so in this case, what we see is the experimental group, the group that received about $100 per year. So this is a very modest amount, reduced screened-in reports by about 2 percentage points. This is about a 10% reduction in screened-in reports. I should note here that these reports do not distinguish between abuse and neglect. And so we're sort of left wondering, is this a neglect-driven question, or is this because of a reduction in abuse? So that's where some of Carrie and I's work starts to step in. And so this is a paper from 2017 published in Children and Youth Services Review. This is a question addressing a question about the minimum wage's effect on child maltreatment rates. And here's sort of the one main takeaway from this paper is that when we increase a state minimum wage by about $1, we reduce neglect reports by about 10%. The overall report rate here is reduced by about 9%, but this is largely driven by neglect rates. And you'll see that there's no change in physical abuse rates, or no significant change, at least, in physical abuse rates, other abuse rates, substantiation rate, or the removal rate. In other words, the foster care entry. So this is largely driven by neglect. And so this is very consistent with that earlier paper by Maria Cancian and her co-authors. Lonnie Berger and his co-authors, Sarah Font, Christy Slack, and Jane Waldfogel, they have a paper looking at the earned income tax credit and unmarried mothers. This was published in the Review of Economics of the Household. And this paper examines what's the effect of all of the different ways that an earned income tax credit can affect a family. So the federal EITC and the state EITC, and calculated the amount of money that a household would receive from the EITC. Their main takeaway, this is their one, they have many tables, but this is sort of the big picture table. What they find is that when we increase income from the EITC of about $1,000, that reduces CPS involvement by between 7 and 10%. So again, very consistent results here. And I should note once again that this is largely driven by neglect. We don't see any significant relationship between the EITC from this paper and any form of abuse. Very recently, here in the last year, Nicole Kovsky and her co-authors also looked at the state EITC, and they took a sort of a different approach here, where they basically compared child maltreatment report rates in states that had a state EITC above and beyond the federal EITC, and compared it to states that did not before and after several EITC expansions at the state level. What these authors find is that when you increase the state earned income tax rate by about 10 percentage points, which is a very large increase, but when you do that, you reduce, that's associated with a reduction in neglect reports by about 10%. Once again, we see no difference here for physical abuse or emotional abuse or sexual abuse, but we really see it here in the neglect reports. So once again, incredibly consistent results here, which is just tremendous to see from a scientific perspective. The last EITC piece that I want to highlight here is a piece by Amanda Beal and Brian Hill, and also in the Review of Economics of the Household. They study the effects of the EITC a different way, and also look at foster care as opposed to child maltreatment. Noting, of course, that many of the entries into foster care system are due to child maltreatment. And so what they do is they examine the earned income tax credit expansion from the American Recovery and Reinvestment Act of 2009, which effectively increased the EITC by about $1,000 on average. And it reduced foster care entry by about 7.5%. And so this is their main table. So again, just incredibly consistent results here. Now, one question that we have had, Carrie and our co-author Will Schneider, that we have had as we've been sort of watching this literature evolve is, okay, this is great that we've got this consistent body of research, but how is this working? Is this really, through changes in material hardship, in terms of, the money aspect, or is this really affecting the ability of families to spend more time with their children and sort of thinking about the time dimension? So we really wanted to know what are these different mechanisms here at play? How do we make sense of these findings in terms of these more causal pathways? And so what we do is we re-examine the minimum wage in a different manner to really focus on those mechanisms. And so just to note here, we examined many, many different mechanisms, thinking about whether minimum wage affects, parents of children in the form of household income, in terms of employment, thinking about if to work, when to work, how much to work. If we think about whether minimum wage affects mental health or other sorts of, well-being measures of a parent, whether it may affect positive behaviors, positive parenting behaviors. Alternatively, we could think about sort of the childcare arrangements or whether a household may be receiving more child support as a result of minimum wage increases. And then lastly, thinking about whether the children, whether they're behaving differently as a result of minimum wage increases. And so that's the bulk of this paper. I'm going to go through a few different tables here because this was such an extensive analysis and really highlight what we find here. So the first thing that we find is that if you increase the minimum wage by $1, that reduces maternal spanking by about 22%. This result is very similar among fathers as well, but that's isolated to young children, so children about age 3. We do also see a reduction in physical aggression by about 27%. This is isolated to older children, so age 9 approximately, and then also psychological aggression at the same time at about year 9. So we see reductions in maternal spanking, in father spanking, in physical aggression and psychological aggression. So these are slightly different than those results that were earlier really focused on neglect. These are also showing effects in other dimensions as well. So when we think about those mechanisms really come through in 2 different forms. The first one is that increasing the minimum wage reduce in our data here, reduce maternal employment by about 6.5%. So this is whether a mother was working for pay in the past 2 weeks. We also see a reduction in when a mother works, and in particular, whether she's working the weekend shift. And this is a substantial reduction here, about 70%. So what this analysis is showing us is that these changes may really be due to, when, a household has a potential increase in income, instead of working more to earn more money, they're actually backing off a little bit, or at least maybe changing, maybe working fewer, less desirable shifts, the weekend shifts. And this may be putting children at less risk of a risky caregiver, for example, or potentially being left alone. So when we think back to that model here of this sort of system synergy model, when we focus on the time and money piece, the research that I just shared with you was really focused right here in this sort of financial implications piece. But there is a boatload of research. That's a scientific term, by the way, a boatload of research going on in a variety of these other domains. So for example, we've seen work by Annalisa Packham and Jillian Carr. Carrie and I have some work as well. Kelly Fong, Julia Fleckman and I have some work on SNAP. Others are also working in this space to determine whether these policies are affecting child maltreatment, in particular neglect. Sarah Font, Emily Warren, and many others are also working in the housing space, trying to understand whether housing policies can effectively reduce neglect. Carrie and I have some ongoing work with other colleagues as well, looking at paid family leave programs. Maria Kanchian in that earlier paper looked at the child support enforcement program. There have been several papers in the last few years that have come out looking at Medicaid expansions in particular. And then there's a pretty new body of research looking at Head Start and other sorts of childcare subsidies and its role in reducing child maltreatment, in particular neglect. And so most of this research is pointing in the same direction. So So going back to that question of what causes neglect, do we really need to know that right now before we can start implementing some of these programs and start advocating for these programs to be evaluating child neglect as part of their responsibility? So in conclusion, neglect is still very high, and it is also not decreasing over time. And so this is something that deserves quite a bit of attention. And possibly it's because of these very complex interactions with poverty and with other sorts of inability or unwillingness to to provide for a child, not just sort of at the family level, but at the macro level, at the societal level, sort of the neglect of families. I think somebody mentioned that in the discussion, that policies are neglecting families. And so who's responsible? Right now we're punishing families, despite, they may not be the ones who are able to make some of these changes. So policies that address the underlying social and economic problems that do contribute to poverty, these are offering quite a bit of promise. And as I mentioned earlier, they're incredibly consistent in terms of measurement, using various different data sources, using various different empirical approaches. They're showing they're painting a very similar picture. And perhaps it's because they're targeting this macro level environment as opposed to the family unit. We know that therapy and psychosocial interventions aren't really working, at least in terms of preventing neglect. And so we sort of need to look somewhere else. And so our suggestion here is to look at this macro level in policy environment, because I think we think it has a lot of promise for reducing and preventing neglect. Thank you very much. I'm happy to take additional questions.
Thank you very much for a very elegant presentation, really unpacking the mechanisms and the causal pathways here. I think it's super interesting, and just based on the discussion, I think a lot of folks in the audience are really resonating with what you've presented today. So we do have some questions coming in, and I have some of my own to share, but let's just kind of work through these. So Brianna Anderson asks, what about the connection between neglect and substance use disorder in parents?
Yeah, that's a complicated one. I will say that is sort of what we think of as maybe the unique domain, if you will. So when you think about this circle here, you can see my circle, right? Mm-hmm. Yeah, okay. So substance use and misuse is one of the few areas that, so CPS has a pretty strong ability to intervene in that domain. So for that reason, we sort of left it off of this particular figure when thinking through the different domains that and different systems that can sort of work together to reduce and prevent neglect. So first of all, that's a little bit complicated of a connection there, but it is something that CPS agencies are actively working in, whereas these other spaces maybe are left unattended.
Thank you. Your presentation made me reflect on, I often think about Joanne Clevens, who spoke about, we need to stop trying to fix families and figure out how to support families. Really interesting kind of reframing of a lot of the work in this space. And it's interesting to see how much things have shifted in the research and in prevention work. Let's see, Kira Hess asks, is there space in this model for replacing or sharing the space Child Protective Services takes up with a structured, well-funded state or county-run prevention case management program? So sort of shifting what intervention looks like for families. Do you have thoughts on that?
That's a great point. So one thing that we are very clear about in this paper and in our communications is that we're not trying to replace Child Protective Services. To be clear, that's not necessarily on this particular agenda. And so we do believe that there is there is space for Child Protective Services, but as it stands right now, they are quote unquote responsible for so many of these light touch cases that they just are not equipped to handle. And so what we're suggesting here is that we shift those cases to these other domains, to these other policies and programs, so that CPS is not burdened by those cases that they aren't equipped to handle. And so that's exactly what in some ways, what we're arguing is that these other programs as they stand right now are more responsible for sharing that burden as opposed to leaving it entirely on CPS, which they just aren't. That's not what it was designed to do. And you can look at the legislation, you can, from decades ago that created the system, and that just wasn't what it was equipped to do.
If I could add, so a lot of our work, especially looks at, whether or not families are even reported to CPS in the first place. And a lot of these policies, especially economic policies, are reducing kids even being reported to CPS. And that kind of prevention, I think, is really powerful. And so while I'm certainly not opposed to well-funded case management by any stretch, I think the idea of helping families really and empowering families so that they don't need these services is really sort of the sort of goal that we're looking for and hoping for. I think all of us would hope for that in our own families and for those of others. So this idea of like really primary prevention through giving family resources, and what we sort of simplify as just time and money, is actually really powerful. And of course, there are more complicated cases out there like substance abuse and mental health issues that aren't going to just be solved with time and money. But if we can solve some cases, then CPS and case management can really drill down and really help provide intensive case management for these other cases that are more complex in a really meaningful way. And I think that's, really how we want to be using these social service programs.
Great, thank you. Another interesting question, do we know if there's a point of diminishing returns for these economic interventions?
It's a great question. Empirically, I think the answer is we don't know. I'm going to use our paper, Carrie and I's paper from 2017 to answer this question, or at least answer it, provide some discussion for it. So just if we think about the minimum wage, so this is the Children and Youth Services Review paper. So in this paper, we looked at data from 2004 to 2014. And so state minimum wage changes were, 50 cents or $1. $1 was way higher than what any of these were. We're talking very, very small changes during that time period. And so we've received the question sometimes, there's the push for the $15 minimum wage. Do we expect that neglect rates are going to decline by, 50% if we do that? And I think Carrie and I would both say, I don't think that's a reasonable expectation, because, at some point, what we know about, wage hikes of that large is that there may be some adverse employment effects. And we know that that those huge, employment shocks are not good for kids. But that, from what we can glean from this research is that, these smaller changes, incremental changes, can be effective at reducing neglect. We don't know at this point what would happen, just because we don't have the empirical evidence. We don't have solid empirical evidence to see if we increase minimum wage from $7 to $15, if we would expect the same results, and I don't think we would. But it is possible. We just don't know.
I think also the question of diminishing marginal returns can be thought of in two different ways. Lindsey answered it from a policy specific lens, I think that's one way to think of it. Each policy probably does have diminishing returns. I would argue for most policies, we're pretty far away from where that arc would start to bend. But the other way to think about it is from a systems wide perspective, right? Like if sort of all systems kind of work together, and if we always look at one policy at a time, like shifting one policy at a time, but like in this sort of structure, and if we moved structures together to really support and empower families and communities, what would that look like? I mean, yes, there's probably some diminishing, there definitely are. I mean, I just don't know where they are. And again, I think we're pretty far off from that I'm comfortable saying we should probably improve some programs, and then we'll start to worry about the slowdown later.
Great, thanks. Well, related to that, Rebecca Orsi made a comment that she expects that the 2021 child tax credit, if it had continued in its monthly format into 2022, would have been a powerful policy to address neglect in addition to poverty. What are your thoughts on that?
We are investigating something along those lines right now so that we can better answer this question. We agree that, you know, it's quite possible and quite probable that that child tax credit as part of the rescue plan was impactful in reducing some form of child neglect. We don't know, you know, there isn't any research out there yet looking at this particular question. But given the body of research that I've shared with you today and others, we would expect that, yes, there have been effects on neglect and maybe even other forms of maltreatment.
I dropped into the chat a newsletter about how much the EITC that just sort of ended did change child poverty rates in this country substantially. The other thing, though, that I think will be important when we see research coming out about the effects of the current child credit expansion is to, you know, just remember the environment in which those credits happened. They happened in a time of COVID and a time of lots of stress for families with children. I have 3 small children. It's a mess. We were talking about this previous to the start. And so, you know, I think we will certainly see that it helped families when researchers inevitably research the current child tax credit. But I think we have to, my expectation is that those results are attenuated because the environment is just so difficult for children right now. And if we had that same kind of financial support in sort of normal times or the before times or whatever the post times, should we ever reach that, look like the child tax credit could have even sort of larger effects than what I suspect, what I sort of hypothesize that research will eventually find.
There is also a new, maybe in the last week, JAMA Pediatrics, I can't remember off the top of my head, but a new paper that shows the child tax credit reduced food insecurity among families. And so, you know, to the extent that food insecurity is part of neglect and results in a neglect report, for example, then yes, absolutely, we would expect that. So that is one of the few pieces of empirical evidence that we do have.
Great, thank you. Well, we'll stay tuned for more research to come on that. Peter Dawson raised a couple of other sort of important pieces of this. Specific areas of intervention, one, unintended pregnancy, which public health folks are close to and often looking at and see as an outcome of interest, and also housing policy, which has been in the media a lot, and also certainly in this pandemic period, looking at housing, evictions, et cetera. Can you comment on their importance in your sort of conceptual model of this?
Yeah, so we would say, the research would say that adolescent fertility, that was the first one, right?
Mm-hmm. Unintended pregnancy, but yeah. Mm-hmm.
Okay, unintended pregnancy. Well, I can speak to adolescent fertility. The research would say that teenage pregnancy is a risk factor for maltreatment. And so to the extent that any of these different components would affect a risk factor, such as teen pregnancy or unintended pregnancy, then absolutely that, that would sort of be a middle piece here. And then with regard to, did you say evictions
housing, well, housing stability, et cetera.
Yeah, absolutely. So, so Kelly Fong and I have a paper looking at evictions and child maltreatment reports, and this paper is interesting because it showed us slightly different than what we expected. So, what we see in that paper is that evictions in a particular neighborhood, a very small neighborhood, reduce neglect reports. Increased neglect reports, so more evictions, more neglect reports, but among adolescents, which was a very interesting finding because we expected it to be more so among young children. But that's, similarly, that would be sort of one of these, like, part of the causal chain, right? Like how these policies may affect teen pregnancy or unintended pregnancy, which therefore then affects child maltreatment or child neglect. Same thing with eviction, sort of being as part of this chain of events.
Great, thank you for that answer.
I think the teen pregnancy thing is like super interesting. It's one of the areas of research I started thinking about in graduate school. And teen pregnancy in this country has been falling, precipitously since 1990, right? In the 90s, it was like 61 per 1,000 teens, and now we're down to about 17 or so. But we have not seen a parallel trend of decline in neglect, right? That first slide, the Finkelhor and his colleagues generated, shows neglect being somewhat intractable. So while I'm not, of course, I agree it's a risk factor. The research shows it's a risk factor. I think there's probably more to it. And I'm not, of course, this is implied, but like there's just more to it than simply declining teen pregnancy and perhaps other kinds of pregnancies as well. So I'll drop a link in the about teen pregnancy rates as well.
Great, thanks. And we'll try to include some of these resources and links to other papers in the follow-up materials that are coming in through the chat. So this is great. I know we're almost out of time, but I'd love to sneak in one more question from Anna Winquest. How do you translate your findings as a researcher and faculty to policy? What does that look like?
I think the policy implications, in my view, are very clear here. That if we have any sort of change in SNAP policy or National School Lunch Program or WIC policy, if we find that there's, or any of these sort of outside, these are the policies right here. Can you see my mouse? I'm not sure if you can even see my mouse.
We can.
Okay, great. So if you look at any of these policies and the research that's coming out showing the relationship between these policies and child neglect, if our goal is to reduce child neglect, then we should do more of these policies or expand these policies or reduce whatever the research would suggest. And so, as a researcher, I try to be, I'm very passionate about reducing child maltreatment, but I'm agnostic about how it happens. And so I want to be, very clear about, what does the research tell us? And if the research says this is an effective policy, policy A is an effective policy, but policy B is not, then let's do more of policy A and less of policy B, or just leave policy B alone if it's got other benefits in some other dimension. So if our focus is child neglect, which we argue it should be, given its enormous prevalence in the lives of families, then I think that's a very easy takeaway from what this body of research is showing.
That Lindsey summarizes it perfectly. I would just add, and I know this is important to Lindsey as well, that it's important to us to hear from practitioners and advocates on the ground, so that we're not just translating research, but they're translating problems and obstacles and barriers to us, so that our research can be as appropriate and informed and useful as possible. So I know Lindsey gave emails, or Sarah has given emails at some point, but I think we're also always open to talking about what's going on in potential research partnerships.
Well, that's a beautiful point to end on. And I just want to thank you both so much for being here and sharing this really important work with us. And to everyone listening and engaging in the chat and the Q&A, great discussion. And I think, we hope to just keep this conversation going. And so thanks, Lindsey, for putting your contact information up here. And we'll provide a lot of these resources with the follow-up email as well. So thanks again, everyone. And I hope you all have a great rest of your day.
Thank you.
Thank you.